Namaste, I am Dr. Beena Bansal, Director, Door to Care Endocrine and Diabetes Clinic. I wanted to present a case of a newly diagnosed type 2 diabetes patient with a high baseline HbA1c level. He is a 45-year-old male who was newly diagnosed around 6 months back. He visited us with multiple risk factors like obesity, hypertension, and dyslipidemia. Initially, he was initiated on metformin, of course, along with lifestyle and diet modifications. On a follow-up visit, his HbA1c had come down from initial 10% to 8.5%. His eGFR was 80 ml per minute. LDL cholesterol was 80. BMI was 31 kg per meter square. And he was on metformin 1000 milligram twice a day, lisinopril, metoprolol, atorvastatin, and aspirin. So we know from studies now that early and intensive management of type 2 diabetes is important. UKPDS trial has shown that first 10 years of intensive control has a long-term effect. It has a legacy effect because cardiovascular event rate 10 years post-trial also was less in the group who was intensely controlled in the first 10 years of diabetes. So when one drug is not sufficient, or even initially if the HbA1c is high, it is important to consider second drug, if possible, which acts through different pathophysiology. As we understand that type 2 diabetes is a complex disorder which happens because of pathology in 8 different organs and the impaired crosstalk between liver, kidney, pancreas, all these various organs are affected. And the drugs used to manage diabetes also have to act through all these different pathophysiological pathways. So early combination therapy therefore makes sense. Instead of stepping up gradually one by one, it is important to start medicines in combination, which can act through multiple pathophysiological pathways. That will also help us in achieving good HbA1c control from the very beginning. Also because combinations like empagliflozin and linagliptin, both of which are efficacy-wise, they are efficacious, safe medicines, and the risk of hypoglycemia is minimal. Also, there is an additional advantage of weight loss. However, more importantly, because ultimately type 2 diabetes management is not just about diabetes management, it is about prevention of cardiovascular disease and kidney dysfunction or other microvascular diseases in future. And these medicines have shown to improve end organ complications risk. So SGLT2 inhibitor has been shown to reduce the risk of CVD, CHF, and CKD. Therefore, EMPA plus LINA combination is a good addition to consider in patients who are having high HbA1c initial in the course of diabetes management. The expected HbA1c reduction over and above what was achieved with metformin is approximately 1.5 to 1.8%. So that is what we did. We initiated EMPA plus LINA combination in this patient, and after 3 months, HbA1c came down to 6%. Weight also came down by 5 kgs, and blood pressure management also improved because of impact of SGLT2 inhibitor and lifestyle management. So to summarize, EMPA plus LINA combination provides robust HbA1c reduction and 2 to 4 times higher odds of patient reaching goal HbA1c compared to individual agents. All this with a minimal risk of hypoglycemia, with additional benefits on weight loss and improved complication risk profile. Thank you.